Hi, my name is Dr. Michelle Cotty, and I'm a psychiatric mental health nurse practitioner. Today, we are going to be talking about healthy versus unhealthy coping strategies. So, if you've been following along in this series, so far you've accomplished quite a lot. You've been able to identify signs and symptoms of depression and automatic thoughts. You've also been able to identify your feelings and your needs. We've recalled times we've had strong positive and strong negative emotions. We have learned about Socratic questioning and challenging our own thoughts. In addition, we've learned some healthy coping tools, including guided meditation and progressive muscle relaxation. Later today, you can add a breathing technique into your healthy coping tool bucket. All right, so let's review some key points from the previous sessions. Emotions come in ranges. Are the emotions you feeling proportionate to the situation? You should expect to feel everything. That is not a bad thing. Negative emotions are a normal part of life. I want you guys to give yourself credit. Every day when you reach your goal of spending 5 minutes on challenging your thoughts, make sure you give yourself credit. Small changes have really big results over time. I want you to stop the video for a second after I tell you what to do and ask yourself, are you finding the same negative thought pops up? And if so, have you been able to identify a pattern? So are there negative thoughts that are popping up maybe at the same time of day, maybe when the same situation occurs, and are you able to find a pattern? If you're able to find a pattern, can you identify a cognitive distortion? I like to think of cognitive behavioral therapy as a tree. If you think of tree roots, our belief about ourselves that we gather in childhood would be the roots. And our tree trunk grows from those roots. And that trunk is our cognitive distortions. So if you think of the branches as situations, every time a situation arises, we have an automatic thought that we're seeing through that distorted lens, which causes a feeling and then a behavior. And sometimes those feelings are rooted in things from childhood. So keep an eye on what your cognitive distortions are and if patterns are arising. Now we're going to look at the worksheet, which discusses healthy and unhealthy coping strategies. And you can find that on our website. So coping strategies are actions that we take consciously or unconsciously to deal with stress, problems, or uncomfortable emotions. Unhealthy coping strategies might feel good in the moment, but have long-term negative consequences. They may not provide instant gratification, but they lead to long-lasting positive outcomes. So examples of unhealthy coping strategies: drug or alcohol use, overeating, procrastination, sleeping too much or too little, social withdrawal, self-harm, and aggression. Examples of healthy coping strategies: exercise, talking about your problems, healthy eating, seeking professional help, relaxation techniques like we've been learning, social support, and problem-solving techniques. Now below are 3 example scenarios, and we're just going to go through one. And then when we get to the end of this worksheet, again, I want you to pause the video and take your time to work through it. So in the first example scenario, Noelle has a research paper due in one of her classes, but because the paper will require so much work, she's anxious every time she thinks about it. So she distracts herself with other activities and feels better. She uses the coping strategy of procrastination to avoid her feelings of anxiety. This helps her feel better for now, but will cause problems in the long run. So if we're thinking about this scenario, there are negative consequences that are going to result from her unhealthy coping strategy. Maybe she won't have time to complete the paper. Maybe she'll feel twice as anxious when it's almost due. Maybe she'll rush through it and not do as good of a job as she could have. What healthy coping strategies could be helpful? Well, she could exercise before she starts the paper and work on small parts of it every week so that she doesn't, or every day, so that she doesn't feel overwhelmed and that she has time to get it reviewed by her professor before it's due. So that would be healthy coping strategies. What barriers might be preventing the individual from using these strategies? Well, one barrier would be the anxiety. So I think that running or working out might be helpful. And two might just be bad habits. Maybe she's never thought about doing anything besides procrastinating. Sometimes unhealthy coping is nothing more than a bad habit. And when somebody is aware that they can do better, then they do better. So go ahead and stop the video now and work through these other two scenarios and ask yourself the scenario discussion questions. Okay, great. So now we're going to talk about your own personal healthy versus unhealthy coping strategies. And again, when I get to the end of this worksheet, I want you to pause the video and work through this on your own. So I want you to describe a problem that you are currently dealing with. And then I want you to list unhealthy coping strategies. What are the consequences of these unhealthy coping strategies? What are healthy coping strategies that you could use instead? And what are the expected outcomes of these strategies? What are barriers to using these strategies? So go ahead and stop the video there until that worksheet is completed. Okay, so one healthy technique that we have not tried yet is a breathing technique. So on the website, there's a 3-minute breathing video, also on YouTube, that you can try at night or in the morning whenever you are practicing your progressive muscle relaxation and your guided meditation. This week, it's breathing techniques. Now is a really fun exercise. Let's pretend that when you filled out your worksheet, your situation was that every time you walked into the house and saw dishes in the sink, you became very angry. And your unhealthy coping strategy was doing it yourself, yelling, and having a glass of wine. Consequences of those unhealthy coping strategies can feel disconnection from your family, frustration, the problem's not getting solved, and maybe you have a headache when you wake up in the morning. Healthy coping strategies that you could use instead is to use assertive communication techniques. Write a coping card so that you remember a way to act differently when you walk in the door. And then talk to your family about a plan to have the dishes not in the sink when you get home. Expected outcomes would be that you'd feel a lot better, you'd get along with your family better, and you wouldn't have a headache in the morning. But barriers to using this might be that when you get home from work, you're so tired and so crabby and hungry that you don't feel like you have time to talk to anybody about the dishes, and you don't maybe think that they would listen, and you have negative cognitive distortions in your mind about the potential outcome. Maybe everybody's just rushing out to practice and they were going to do the dishes when they get home, but every time they get home, you've already done them. So when we're thinking about that situation, a coping card is something that we could use to remind us of a different way to behave. Let's pretend you're picking somebody up from school every day and you get really frustrated when they've forgotten their iPad or they're not wearing their mask or whatever stressor you can think of. You would put the coping card in your car so that it would be there. Perhaps you're going into a meeting at work, you feel really anxious, and you hate walking into big work meetings. You could put a coping card that says, "Nobody is looking at me," and you can walk in and sit down. So today we discussed healthy versus unhealthy coping. When you go to the link of coping cards, there is a ton of different coping strategies you can use. Print them off, decorate them, make your own note cards, and put them where you need them to go. If when you're stressed out, you open the fridge and look for a snack, you could put a coping card that says, "Take a walk instead." When emotions arise, we have to cope. So we can choose from unhealthy or healthy coping. And unhealthy coping habits are identified today, and healthy coping strategies were reviewed. So our goal is to replace our unhealthy coping habits with new ones. We have the breathing technique today as our healthy coping tool. And when we analyze the way that we're acting, we are more likely to do something different. So keep working on identifying your own cognitive distortions and replacing your negative thoughts with your positive thoughts. And give yourself credit. You're here. Great job, guys. Have a wonderful day.